Hi, today we're in the University of Alberta Oral Health Clinics, and I'm going to demonstrate to you how to don appropriately a clinical gown. So we see that we have a selection of sizes for our clinical gowns. These gowns are located in the alcoves, in our east-west alcoves in the main clinical spaces, and you can choose the size that's appropriate for your body shape and size. Once you have selected your gown, we want to inspect the gown and make sure that the snaps are functioning and that it has both ties on it. There is a right and a wrong way for this gown to go on. The outside of the gown is identified by the pocket. So we just slide your hands into the gown appropriately, and then we're going to fasten the snaps at the neck. And there are ties on the sides of the gown that we're going to fasten on the back of the gown. The things that we'd like to avoid when you're wearing a gown is we want to avoid pushing the sleeves up to leave the arms exposed. The sleeves should be down and covering any wrist jewelry or watch if you're wearing it, and to have the gown go underneath the cuff of your glove. We also want to make sure that the ties are tied in the back and not in the front. We don't want to tie them in the front because this is a risk for cross-infection when we're going to take the gown off. And we always want to make sure that the gown is tied as well. We don't want to leave it undone. So the gown must be tied in the back. Now that we've donned our gown, we will gather the remainder of our armamentarium and materials and head into the main body of the clinic to don the remainder of the PPE and set up our operatory for care. So we've donned our gown, and the next step in donning PPE is to put on a mask. So in our clinics we have several choices of masks to choose from. We have what's called the ear loop mask, and this is easily identified because there's loops on the side of it, and these, you guessed it, go around your ears. We also have a tie mask, and the tie masks have ties instead of loops, and these go around your head and neck. And we have what's called a cone mask or a molded mask, and this one actually has an elastic, a single elastic loop that goes around the back of your head. So first I'm going to talk about the ear loop mask, and this ear loop mask is the most commonly used mask in our clinics. It does have an inside and an outside, a right way and a wrong way to put it on. The inside is identified by the smooth surface. The outside has these little tabs on the outside, and you can tell that those need to go to the outside of the mask. There is a top and a bottom to all of our masks. The top part of the mask is easily identifiable because there's a metal strip that molds to the bridge of your nose on the top of the mask. So when we put this on, what we want to do is we want to mold the bridge of our nose first with the metal strip, and then put a loop around each of your ears. Once you have it in place, we want to unfold the mask so it goes down underneath our chin, and make sure that the bar is molded to your nose. So there's a few do's and don'ts when you're wearing a mask. We want to make sure that we're never touching the mask by the front surface of the mask, and we never want to see you do this. This is bad. We don't want this because this forces cross-contamination to go from the outside of the mask to the inside of the mask, and it will contaminate you. So once a mask is in place, it's on, and we leave it there until the end of the clinical space. And once we're finished with it, then we can take it off. And I'll show you how to take off a mask. As we said, we don't ever want to touch the mask by the front of the mask. We only ever want to touch it by the sides. So we would have cleaned our hands after taking off our gloves, and with clean hands, we want to be careful not to touch your face with hands that haven't been freshly cleaned and could be contaminated. With clean hands, we're going to grasp the mask by the ear loop and remove it completely, and this mask will then go directly into the garbage. We never ever want to see you crumple up a mask or leave a mask on the counter or put it in a pocket. When a mask comes off, it's considered a contaminated piece of protective equipment, and it needs to go directly into the garbage once it's taken off. Now let's talk about the tie mask. So tie masks are frequently worn by those people that aren't easily able to put a loop around their ears, and some people just prefer it's comfortable. So when you first come to clinic, I encourage you to try all the sorts of masks so that you can discern which mask is best for you. So again, this mask has an inside and an outside. It's a little bit easier to tell with this one because there's a color difference between the inside and outside. The more vibrant color goes to the outside of the mask, and the paler color is on the inside of the mask. There is also a top and a bottom, same as the ear loop mask. The top of the mask is identified by that metal bar. So when you're putting on a tie mask, we want to begin by molding the bar to the bridge of your nose. And then we're going to grasp a tie, bring it to the crown of your head, and grasp the other tie, bring it to the crown of your head. And we're just going to tie it up at the top of your head. And you can see the angle of this strap goes up above my ear and to the top of my head. And then with the bottom strap, we're going to tie it. And you can see this tie here goes around the base of my skull or near my neck. And I'm going to tie that here. And once I get everything in place, then we will adjust the mask for a final fit and make sure it's comfortable. We're adjusting the nose and making sure that the mask is unfolded and goes underneath the chin. And then you're ready to work in your tie mask. To take a tie mask off, it's a little bit more tricky because once the ties are undone, we don't want the mask to fall against us. So we're always going to start nape of the neck and lean forward. As you can see, I'm leaning forward so the ties fall away from me. And then I'm going to take the mask and untie the top tie, and by the ties, it will go into the garbage. What we don't want to see you do is take that mask and handle it by the front or tear it off, and we don't want it to cross-contaminate your hands. Of course, every time that we're going to touch our facial PPE, we want to make sure that we clean our hands beforehand. The final mask we'll talk about is called the cone mask. And the cone mask is a little bit more obvious because you can really see that metal bar that goes over top of the nose, and it's shaped kind of like a face. But you need to put it on a little bit differently than the other two masks. So we're going to hold the cone in our hand like a soup bowl, if you will, and then we're going to lean forward and plate our face into the mask and take this strap and push it over top of our head. And you can see that the strap goes to the top above my ear to the crown of my head. And once I have it on, I want to make sure that the nose bar is shaped to my nose and that the bottom of the mask comes down around the curve of my chin. And for the exact opposite procedure, when we're going to take this mask off, when we call it doffing the mask, we're going to take it off. We would then lean forward, grasp the mask by the strap, pull it off of our face, being cautious not to cross-contaminate yourself, and the mask goes right directly in the garbage afterwards. That's masks, which is an important step in our PPE journey. I'm going to talk a little bit about glasses as well too, and then we'll put the whole picture together. We have several types of glasses that you might see in our clinical spaces. These are called over the glasses. So if you wear spectacles or prescription eyeglasses, these are the type of safety glass that will fit over top of your prescription eyewear. And these are just my regular safety glasses. Notice that they have side shields. The side shields can be a separate piece that comes deep around the corner, or it can be a molded lens. You can see that this lens is curved, and it will enable me to have protection from the side splashes on my eye. And finally, most students you'll find will wear loupes in our clinical spaces. Loupes must have fixed hard side shields in order to be acceptable in our clinics. And whether or not you have the raised magnifier or you have a fixed magnifier, the procedure is still the same. We do encourage, if you're going to wear loupes in clinic, that you always have some way to affix the loupes to your head, because the weight of these will cause them to slip down your nose, and we have had occasion where they do fall and hit a patient. So always make sure that you have your loupes secured by a strap around the back of your head when you're working on them so that they don't slip intra-procedurally. I'm going to demonstrate first and foremost the glasses that go over top of prescription lenses. So these are my prescription glasses, and we would just have a lens that goes over top of our prescription eyewear, and you can see that it fits over top, and this would go over top of a mask. So you can see what it looks like. We're going to don our mask first. And we'll put our prescription, these are my regular safety glasses that I wear when I'm not wearing my prescription lenses, and they go over top, and you can see that my glasses sit right over top of my mask. And the idea is to provide me with as much facial protection from contaminants as possible. It's the best if your glasses can overlap with your mask, and making sure that this nose bar is fit well to your face so that your glasses don't fog up. The last option, of course, is loupes, and these guys here are loupes, and we would just set them over top, having the strap across the back. And we want to make sure that you fasten the strap to the back of your head so that these glasses are not going to move or slide forward intra-procedurally. Again, fitting over top of your mask, making sure that your mask fits securely underneath your loupes. When we doff our glasses, the glasses are the same as masks. Masks are on for the entire procedure and we take them off at the end of the procedure. This is not typically something we would touch or move during a procedure when we're working with our patients. When we take them off, we'd like to make sure that we only touch them by the backs or the arms of the glasses rather than the front. What we don't want to do is grasping by the front of the glasses, because the front of the glasses is like the front of a mask and it's considered contaminated. So when we're going to take these guys off, we're going to take them off by the arms only and set them down. All glasses, when they remove from your face, remain in the operatory until they've been cleaned and disinfected prior to taking them out. Even your loupes must be cleaned and disinfected before taking them out of an operatory after a procedure. So now we have our full PPE on. We're going to go ahead and learn how to perform hand hygiene. Hand hygiene can be performed in two different ways. One using soap and water and towels, and the other with alcohol-based hand sanitizer. So first I'm going to demonstrate how to wash your hands appropriately. This is a routine hand wash that you will use at all times in our clinic except for when you're in oral surgery. And this hand wash should take you about 20 seconds, maybe 15 to 20 seconds. Think about singing the song Happy Birthday in a nice, slow, even fashion. That's about how long you should be washing your hands for. So for this we need a soap, and we want to make sure that, a sink, and we want to make sure that we're adjusting the overall temperature and water flow before we begin our procedure. So we've got the water flowing and we have soap here, so I'm going to wet my hands to start. And then I'm going to get soap. And you want to have an adequate amount of soap to create lots of bubbles. What cleans our hands when we're washing our hands is the actual friction and the emulsification of the microbes into the soap that we're going to then wash off. What we need to do is make sure that we're washing all of the surfaces of the hands, in between the fingers, dorsum of the hands, palms of the hands, don't forget the sides of your hands, thumbs on each hand, and fingertips. We want to make sure that we're paying special attention to making sure that our fingertips are cleaned as well too. Once you've got plenty of soap and have done that 15 to 20 second rub with your hands, then we're going to rinse them. We're going to rinse our hands, allowing the soap to come off of our hands. It's important to rinse your hands thoroughly. Don't leave any soap residue on, because that will affect the health of your hands. And then we're always going to use disposable towels. If you're ever in a clinic where they have reusable towels, like the kind of towel that you see at Grandma's house near the sink, please don't use it. We only use disposable towels when we're drying our hands. Notice that I'm not rubbing my hands, I'm more patting my hands. This is to protect the integrity of the skin on my hands, because I'm going to be washing my hands many, many times throughout the day. Make your hands as dry as possible. It will make your life easier when you're trying to put on gloves. And again, we're going to try and not use our hands to touch anything, and we're going to just place the towel in the trash. We have gloves in various sizes, small, medium, large, extra large, and we have extra small gloves that are available in each operatory. They're located here on the door as well. So my glove size is a medium. I'm going to choose 2 gloves. And these are just regular examination gloves. When we're putting on our gloves, we want to make sure that you put your hand in the glove, pull the cuff over top of your gown cuff. This helps to protect your wrist from cross-contamination. And we're going to put the other glove on over top of our cuff, maybe over top of our cuff. So now we're ready to go and ready for patient care. When you're doffing gloves, we want to be careful not to cross-contaminate ourselves. We must imagine that our gloves are now covered with our patient's saliva, and we want to take these gloves off without cross-contaminating ourselves. So to do this, what we do is we grasp one glove and pull it off. Notice I'm not going underneath the glove, I'm grabbing it by the surface of the glove, and I'm going to take this glove and I'm going to hold it in this hand, and then I'm going to take my clean finger and go underneath my glove and pull this one off so that my contaminated gloves are both turned inside out and there's no contamination that happens to my hands. And I'm going to put those in the garbage. Always, the final step for removing or doffing gloves is always hand hygiene. You can go ahead and wash your hands again, or you can use alcohol-based hand sanitizer. So now we're going to talk about hand hygiene using alcohol-based hand sanitizer. A few pointers about alcohol-based hand sanitizer. All sanitizers are not created equal. You must use one that has alcohol content of between 70 and 90%, and it has to have either an NPN number or a DIN number, which is a drug identification or a natural products number that's issued by the Government of Canada in order for it to be used in our clinical spaces. When we're using alcohol-based hand sanitizer, we're going to use the same procedure as we would do for our hand washing, and so we want to dispense enough product that we're going to be able to cover all surfaces of our hand. Basically 2 pumps is usually enough, depending on your hand size, and we're going to follow the same procedure that we do when we're washing our hands. Using friction, we're going to make sure that the alcohol-based hand sanitizer goes on all surfaces of our hands, making sure that we get the sides of our hands, our thumbs, tips of my fingers, and the idea is that an alcohol-based hand sanitizer hand rub should take approximately as long as an actual hand wash does. We're going to continue to rub our hands until the product is dry and we're ready to don our gloves. We don't want to see people putting hand sanitizer on and then waving their hands to dry. The idea is to provide the friction together with the alcohol product, and it will help to kill the microbes that are on our hands. So now that my hands are dry and I've rubbed all of that product in, we can go ahead and don gloves in the same manner as we do after we do a hand wash. I have 2 gloves. I've rubbed my hands, they're nice and clean. My hands are not dry enough. Try this again. We're going to don the gloves, making sure that the cuff of the glove comes up over top of your gown cuff to prevent cross-contamination of your wrists. Second glove in the same manner, and those are donned. And to doff them, again, pulling one glove off, grasping it in the other hand underneath the surface of the glove, pulling it forward, and our gloves go into the garbage. Final step of doffing gloves is always hand hygiene. And the reason why I want to clean my hands is that studies show 1 in 4 gloves have micropores and they leak. So even though we're protecting our hands from patient contamination, we could be inadvertently becoming contaminated because of any kind of micro leaks that are in the glove. So with clean hands, I want to begin removing my PPE. The first step to remove your PPE is taking off your glasses. And we're going to leave these in the operatory so that they can be disinfected when we're cleaning our operatory. The second step is to remove your mask, and to remove the mask, we're always going to remove it by the ear straps, the ties, or the elastic around the back of the head. And it comes off and it goes directly into the garbage. We're not going to handle it or crumple it. And then the third step of doffing PPE is to take your gown off. And when we're removing our gowns, we always want to begin here at the neck and move to the waist. And the rationale for that is that here at the neck, this is closest to us, and our hands are currently the cleanest that because we've just cleaned them, provides less cross-contamination to remove the top of the gown first, bottom of the gown second. And then to do this, we don't want to touch the outside of the gown because it's been contaminated by patients. To take this off, we're going to slip our hands inside the collar of our gown. Touching the inside of my gown, I'm going to pull it off. And notice I'm kind of rolling it inside so that the inside surface becomes the outside of the gown, and then I'm going to roll it down like this so that all of the contaminated surfaces of the gown are contained within this bundle, and then this bundle will be put in the soiled utility room. The final step in removing your gown is always hand hygiene. Yeah, then you go off into the world with clean hands. So returning your soiled gown, we want to make sure it goes into the soiled utility and not where the clean gowns go, and into the soiled bin.